Breastfeeding is considered the biological norm. However, there are many potential problems and complications that can be associated with breastfeeding. The first thing I wanted to go into is the pain of breastfeeding. Within the first few hours of a newborn's birth, the mother produces the first form of milk called colostrum. It is rich in nutrients and vitamins and also antibodies the infant needs to survive. However, within several hours to several days, the mother's milk can come in and it can cause engorgement, which is very painful. Engorged breasts can be mild and easily managed, or they can also be severe and take several days. Engorged breasts can also cause clogging of the milk ducts, which can lead to mastitis, which is a form of infection in the milk ducts. Mastitis can cause fevers, chills, flu-like symptoms. It can cause tenderness and redness of the breast. It is very painful. It is not fun. It usually needs treated with antibiotics, so people will have to see a doctor for that. Nowadays, more than back in the old days, there's such thing as a lactation consultant, which is a person that is educated on breastfeeding. Lactation consultants go throughout the delivery rooms and teach new mothers how to latch properly and that kind of thing, which is great while you're in the hospital. However, when you go home, that kind of help is not available and you can get an improper latch. Improper latch can cause severe pain and tenderness in the nipple area. It can cause sore, cracked, bleeding nipples, and this is probably the number one cause for mothers, especially young, to quit breastfeeding because it is very hard to breastfeed on a regular basis when you're in severe pain. Also, I wanted to talk about there are some health issues that can be related to breastfeeding. One of them is jaundice. There's two types of jaundice, breast milk jaundice, which is substances in the mother's milk actually inhibit the infant's ability to process bilirubin in their liver. So bilirubin levels that are increased cause jaundice, cause yellowing of the skin and fever. Breastfeeding jaundice happens quite often, and when breastfeeding jaundice occurs, it's usually the infant is not getting optimal milk intake. So with breastfeeding, you really don't know how much the infant is drinking, so it's important to follow certain hunger cues, and sometimes those are missed. Lastly, for health issues, infectious diseases such as HIV can be transmitted through a mother's milk. Mother's milk is a form of bodily fluid, so mothers who are infected with HIV or any other type of infectious disease actually are unable to feed their infant breast milk. Another major issue with breastfeeding is keeping a good supply. So this, personally for me, was probably the most challenging part. There are a lot of factors that can determine your supply. Some of the biggest are your nutrition, which I know a lot of mothers with a newborn have poor nutrition. We're trying to get, the quickest thing. We're trying to deal with our baby more than us, and it's kind of a sense of selflessness on our part. Also, not getting enough rest. And what mother do you know with a brand new infant gets plenty of rest? I know I don't know very many. Illness or infection, which mastitis is a form of infection. So if a mother gets mastitis, not only is it painful, but it will also decrease her milk supply. And mothers who are drinking caffeine, stress, there's various reasons that breast milk supply can be decreased, so that is another problem. And lastly, I wanted to talk about, although it is more common today than it used to be, there is still a problem with, breastfeeding in public. It's awkward, it's uncomfortable, it's supposed to be private, that kind of thing. Restaurants have made it to where mothers can, or not even just restaurants, but everywhere basically, have made it to where mothers can breastfeed wherever they're allowed to be. However, I know my son in particular, he did not want to be covered. Some days it's really hot, whatever the reason may be, it's hard to juggle a nursing infant and all the other things you have to do to cover up. So that can also be a major difficulty. Um, while breastfeeding may be considered the biological norm, there are many health conditions and factors that play into a mother's decision to breastfeed, and ultimately it should be up to the mother. Fed is best.